Good afternoon. It's Joe Mullings from 160 Studios, and today I've got a special guest, a friend, and somebody who is, I think, a champion of the industry if there ever was one, Scott Whitaker from Advamed. Scott, thanks for joining us again.
Hey, Joe. Always good to be with you and great to be back.
Same, same. So are you from your home today, as everybody else usually is?
Yeah, I'm from my home. We've reopened our office, but only at about 25% capacity right now. And there are a lot of people who really want to get there. And so I've let those others fill up the office, and I'm still working from my home office.
Yeah, and doing great work as usual on behalf of our patients and our country. You and I started chatting, I think, originally right at the beginning of COVID in March, and then you came on shortly thereafter and took us up to speed on where we were then. Now we are, I think, 8 months into this. What can you share with us starting there that Advamed has been so instrumental in the agency as well as the industry in general?
Yeah, it's been an amazing 8 months. Joe, I think back to our first conversation. I don't think either of us fully appreciated what we were getting ready to be hit with, right? And boy, were we hit hard. I've said this a lot recently. I've been so proud of this industry and how we've responded to this crisis, though. I can't imagine where we would be as a country or as a world if it weren't for MedTech stepping up and responding heroically, I would say, in so many ways. I think back to the time when we first had these conversations and we were thinking about personal protective equipment and massive scale up there. We thought we were going to see a ventilator shortage in the country, massive scale up there, and we didn't see a ventilator shortage. And then the uncertainty about testing at that time too. And the government kind of dropped the ball, right, on that first test. And this industry stepped up and delivered on a massive scale testing that's been, again, heroic. And it is amazing what we've accomplished together as an industry. I said 2 years ago, Joe, I don't know if you were there at our conference in Philadelphia. I said, this is an industry that's there when it matters. And I didn't think 2 years later that would be quite this true, right? I mean, we were there when it mattered most, and really, really proud of it, all the industry, and the work goes on. So
yeah. And the FDA has been pretty heroic as well in making sure that they clear the way, still keep the public at center, as always. Yep. Han has done a great job, and now he's going to have to help navigate probably some of the solutions potentially that might be coming downrange. Any insight into that and what's happening there?
Yeah, you're right. FDA's been heroic as well. I think of the work that Jeff Shuren has done leading the center, which has been fantastic. You work your way through that senior staff, and it's been amazing what they've done. I mean, their ability to work with us in a clear and transparent fashion is one of the reasons why probably the major reason why we were able to get done what we were able to get done, from vents to testing and all the way through. And so that's a fantastic agency. You and I have talked before, Joe. I mean, Steve Han came into that job at a tough time and without that much experience. And he inherited a great team, but it's tough to step into that role and lead it. I think he's done a good job, honestly. I think he's done a very good job. Hasn't been without challenges, but he's done a really good job. And to your point, right now, the next issue is around vaccine development and production. And we have, 4 or 5 really good candidates, I think, that FDA is looking at right now. Some of those companies are also MedTech companies in our space. I think at J&J, and there was some news today about their product, the clinical trial that's ongoing, and some encouraging signs. And I think if you ask Dr. Han, I think he would say he feels pretty good about where we are. But the agency's also been under fire to some degree politically. And I think his concern is, I've got to get this right on the science and make sure that it's a sound approval, because you need the American people to be confident in the vaccine and the process that led there. Otherwise, distributing, allocating, and administering the vaccine is not going to go as we would like. And that's a tough thing to balance. That's a hard job to do. And I think he's doing a good job. We're going to talk about it at our conference with him October 5th, 6th, and 7th. So I'm looking forward to that conversation. We'll all learn a little bit more what's on his mind.
Yeah, let's touch on the conference for a second here. I think it's one of the most powerful conferences in our industry. pound for pound, the people who attend and you have access to has always been impressive. And this year it's virtual.
Right. Yeah, virtual, as many conferences have. And we've already started it to some degree. We're starting some live sessions now. And if you haven't tuned in, I would encourage you to do that. The speaker lineup is fantastic. I mentioned Dr. Hahn, who will be one of our keynotes. I also am going to do a session with Magic Johnson, which is fascinating. If you're a basketball person, you'll enjoy the basketball part of the conversation. We also talk about COVID-19, the impact it's had on sports. We talk about business success that he's had, which is going to be interesting. And we're also going to talk a bit about the racial tensions that our country's facing and get his perspective on it as well. So, and then we have other great speakers. Mike Osterholm, that you may know, Joe, a great epidemiologist at the University of Minnesota, is going to talk about COVID from his perspective. You're going to hear from CEOs like Kevin Lobo and Jeff Martha and many, many others. Great lineup of MedTech leaders. And so it's going to be a great session, and I'm really looking forward to it. Hopefully everybody can join. And Joe, you're doing some interviews for us as well, and one of our speakers. So we appreciate your support and your engagement as well.
Yeah, always one of my favorites, because it's always a knockout whoever you chat with on there. You know, going back to Magic, certainly great b-ball player, has overcome some incredible challenges in his life, an amazing entrepreneur. And you touched on something too that I know Advamed is a champion of, is that the racial disparities in the health industry and the inequities there. And MedTech color is always very present at your events. So does Advamed have something in particular going in that area?
We do. It's been something we've been working on, Joe. I would put it in two different categories. So as we describe inclusion and diversity from a hiring standpoint and a staffing standpoint, one aspect of what we've been doing for a year and a half now under Kevin Lobo's leadership as chairman, to try to make sure that inclusion and diversity is part of the DNA of all of our companies. And we've made great progress in that, helping all of our companies understand the value of having diverse workplaces and putting processes in place to make sure that our companies are diverse. And so we've made a lot of progress there. But with all the social issues, the racial injustice and social unrest that's hit us, it's also become more obvious to many that there are racial disparities in healthcare as well. And while we can't solve those ourselves, right? It's a much bigger issue about healthcare access, insurance reforms, things of that nature. There are things that we can do as well. So we set up recently a task force that's looking at this. We expect to come out with some principles in the next month or so. Our executive committee, these are the major CEOs of all of the MedTech companies, have embraced this as a major priority for the organization. And are looking at some policies, and we look forward to engaging in the federal conversation as well about how we can improve the healthcare system. I think of clinical trials as one example, right? Are we doing what we can to make sure that the clinical trials are diverse and representative of all races? And I think there's things we can do in that space, and we'll continue to work on it. And then educating stakeholders as well, Joe, so that people understand racial inequities in healthcare and what it means, and how we can work together to solve it. So it's an important issue. We're very focused on it, and look forward to more news on it soon.
I always appreciate Advamed's position on it and the intention in creating awareness around challenges that most aren't even sort of aware of because of it. It's either endemic and or, again, the clinical trials. I think it's something like 88%, or it could be higher than 90%, are driven by white population and misrepresented across the board.
Yeah, that's exactly right, and we're trying to tackle that, and I think we will. We've got some good suggestions and some good ideas coming out of it.
Yep. Tell me about the recent headlines I heard about the breakthrough rule with CMS and how that might mean investment incentives, reimbursement, and how that may affect the industry.
Yeah, so thanks for bringing that up. It's a great question. We had good news out of CMS recently that they have embraced our proposal, which is to allow automatic coverage of breakthrough technologies that were cleared by the FDA in the Medicare program. So this is something we've been working on with them for a couple of years now. What we've seen, and Joe, you and I have talked about this online and offline, right? We've seen an FDA that has improved performance so much but we haven't seen that same thing occur at the CMS level yet. So they have this wonderful program at FDA that allows an expedited process for a new and novel breakthrough technology to get through the FDA system more quickly. But what then happens is you get cleared by the FDA and then you get stuck for 2 or 3 years and you've got no real path for reimbursement. And that's the valley of death that we've talked about so much. So what CMS has done is they issued a rule that said, as soon as you clear that, you're automatically covered in the Medicare program. And for a company that has a breakthrough product, that gives them a lot of assurance that after that process ends, their product development doesn't end. They don't have to restart raising money, right? It gives investors confidence that there's light at the end of the tunnel of the FDA process. And so we're really, really encouraged by this. There are a couple things in the rule that we want to make sure that we get right when it's final. It's a proposed rule. We have 60 days to comment on it, which we're doing right now. And when it gets final, by the end of the year, I think we'll have some good news. But some diagnostic tools may or may not be included. We want to make sure all of them are in there. As we've learned through COVID, breakthrough technologies in diagnostics are essential to quality healthcare. And so we want to make sure those are covered as well. So, but I think it's a game changer, honestly. In the category of breakthroughs, I think it's going to set a precedent for future approvals at FDA as well to make sure these products get reimbursed by Medicare quickly and thoroughly and predictably, which I think is really important.
Agreed. And certainly the venture community will be happy to hear about that.
Yeah.
The venture community's been unbelievably healthy through this entire situation. But having both regulatory, now reimbursement pathways, at least some obstructions released, is great. And so thank you for that amazing work.
Yeah.
What have we got as we close out 2020 to think about for Advamed and then sliding into 2021? You personally, initiatives and the organization's initiatives.
Yeah, so it's a great question. I mentioned one already. This health disparities initiative is one we're going to focus on in the fourth quarter of this year and try to help get this right. We have a big election coming up, right? Mm-hmm. And once the election is behind us, I think the focus is going to shift to federal policy on the healthcare disparities and healthcare access. And so that's going to be a focus of a lot of our conversations internally. Where do we want to position ourselves? How can we make sure the healthcare system is better for everyone? And at the same time, encourages a strong MedTech ecosystem. So policy development has begun and will continue to do that in the health disparity space. There's another rule that we hope to go final, which is the anti-kickback statute reforms. This is all about value-based healthcare, allowing our companies to partner with hospitals and doctors to create better services, collective services, which we believe lowers costs and provides more quality healthcare. That rule we hope to go final before the end of the year, and we're working with CMS on that right now. And then we have maybe one more package that may come out of Congress, COVID related, right? And we want to make sure that our companies are protected, get access to loans if they need them, and hopefully get some reforms in there around NOLs and some other things that kind of stabilize this industry through the end of this year and into next year. So we've got a few more things to work on this year. And then once the end of the year hits, we'll try to reset ourselves and think about 2021. What are the priorities look like for us at that point in time?
Yeah. Never have more eyes around the world been focused on an industry.
Yeah, that's exactly right. Yeah. And, we welcome that in many ways, Joe. I think we understand the value that we have to the healthcare system. I've never felt like everyone else understands it as well as you and I do.
Yeah.
And it may be that there's some light that comes from this, right? The value of medical technology to the ecosystem, the healthcare ecosystem, is incredible. So we welcome the light because we're proud of who we are and what we've done.
Yeah. Well, Scott, thank you so much for taking time out from your workday as usual. Love the message, love sharing it. And for those that have not quite registered yet for the conference, the Advamed conference, I'll put the digits on the screen here so you can see those. And it is well worth educating yourself and entertaining yourself and checking it out.
Yeah, thank you, Joe. And thank you for participating last year and previous years and this year, and for your partnership with Advamed. We're all grateful for it. Personally, I enjoy it too, and great admirer of you and the work you do. So thank you so much.
Thanks so much, my friend, and I'll chat with you soon. Be well.
All right, good deal.
This is Joe Mullings from 160 Studios. Take care.